I thought one of the things that you gave us was a language that we could turn to those medical specialties. We had our own language, but maybe it was that we just didn't have the confidence to use it with the surgeon or any subdiscipline that was looking at Ben. I thought that was something you helped us with a lot, was to be able to translate our philosophy into a language, into a conversation with the medical field on how we wanted to approach Ben's care.
I think that's interesting you say that. I think sometimes when I'm describing palliative care to people, I say, well, we're interpreters. We are trying to understand what's important for the child and the family, and we're trying to understand what's medically available about very complex things that I'm not an expert on spinal fusion, but we're trying to make sure that the translation is clear. So I think that's, again, a good use of palliative care.
Yeah, I think also just going back to the GI issues, because it was one of the things that we sort of wassilated about in Ben's journey. You know, one time we made a decision this way, then we started rethinking it because he was progressing and things got more complex. And I think what palliative care did, and certainly Pat, is it gave you a space to reevaluate. So maybe 6 months ago I said no feeding tube, but maybe this month, because of what's going on in Ben's world, I want to rethink that decision. So it gave us a space to talk about it, not just with Pat in the palliative care unit, but also to be able to go back to Dr. Russell and say, he also happened to be a very sort of aware person and willing to have those conversations. Not every doctor is willing to approach it with such a sort of a scaled way where you can keep evaluating it. They usually just want an answer, yes or no. But it offered us the opportunity to take our time in evaluating those, and also not to feel threatened if we felt the need to reevaluate them.
Not only threatened, but that feel badly that we had thought differently at a different point in time. That it is a continuum, there is a process, and what we decide 4 months back might be different than what we decide now, because the circumstances have changed. We didn't have to draw a line in the sand and say, we will never do this. And that was something that helpful. Again, I think some of it's a confidence. And we were never shy with talking to doctors, which set many of them back. But it also helped us be able to express those things and feel good about what we were expressing.